Hi, welcome to Organizing Life's Daily Demands. My name is Peter Gordon, and I am the president of New York Financial Organizers. We're daily money managers. We help people pay their bills, file insurance claims, and deal with all the non-investment side of personal finance, essentially organizing life's daily demands. The purpose of this podcast is to introduce the viewers and listeners to other professionals who help people in other areas of their lives. And today I have the pleasure of speaking with Ann Recht of Care Connect Solutions. Hi, Ann. How are you today?
I'm good, Peter. How you doing?
I'm well. It's good to see you.
Same here.
Yeah, Ann and I have known each other for a number of years, pretty much since I started in this business. And why don't you tell us a little bit about your background, and we'll get into what you're doing now.
Sure. So after about 20 years in public relations, mainly for nonprofits, a small stint in real estate, I got my master's in social work and became a care manager, geriatric care manager, which I did for 25 years, including having my own company, which I sold. And after working a few years for that company, I have segued into being a placement specialist for seniors, helping them find independent or assisted living, or doing assessments and showing them how they may be able to live at home with various interventions. So that's my new gig, which I'm enjoying, and it is something that I did as part of being a care manager.
Right. So what does that involve?
Placement specialist, basically the assessment skills I think is so important and something that I've fine-tuned for the last 25 years, in addition to being a licensed social worker. Of really digging deep into who the person is, how they have lived their life, who they are, what their support system is, and other variables that would help to determine what the best place for them is, based on their care needs and other factors such as finances, et cetera, support system.
Right. I mean, it's a huge decision for people and something you can't take lightly.
Absolutely. In most cases, and people do take their time and making that big change, which is probably the reason why a lot of assisted livings, I think when they were built, the developers figured people would move in their early 70s, and it's really into their 80s. And that was from the beginning. And they started about 25, 30 years ago.
Right. And what is it now? People moving in roughly what age?
In the early 80s, average.
Yeah, because people are living longer.
Living longer, right? And people want to stay at home. And I have to say that is the best place if everything is right, if they are getting the right support, being cared for, socialization, stimulation, and having a quality of life that they're used to. If that changes and, they have issues and can't get around and medically or cognitively or declining, and it's just not working at home, it used to be nursing homes were the only option. And now, like I said, as of 25, 30 years ago, we have these assisted livings and independent living.
So talk about the different types of housing for seniors.
Sure. So as noted, community in their own home, living with relatives, renting, obviously, and that as you age and need help, you may need home care and other interventions. And again, if that's not working on a number of levels, we have independent living. And that's exactly how it sounds. And it's 1 or 2 meals a day, full kitchens, and you're expected to live independently. Now, if you need help, you can have your own home health aide, as you would in the community. And in a lot of these places that have been around a while, people are aging in place. And that's the key, to age in place, to not keep moving every few years,
right,
every time you have some setback physically or, again, cognitively. So that's the independent living. Assisted living does give you the care that you need within the building. They have their own home health aides, they have nurses, they have a wellness department. So you can, and it's basically custodial in terms of activities of daily living, such as walking, bathing, dressing, um, toileting. And they do that for you. If somebody just needs to help being showered in the morning, that's part of their care fees. And we can get the costs later. So that's assisted living. And then there's the nursing home, which you do need help with the activities of daily living and some nursing needs, maybe, feeding tube, other things. However, I'm going to backtrack a little bit.
Yeah.
Because in the last 5-10 years, assisted livings applied for what's called enhanced licenses. And they're able to do oxygen, wound care, insulin, infusion. And again, 5-10 years ago, they never would have that. If you were in a wheelchair, you would have to propel yourself. In some communities wouldn't have wheelchairs. Now, every assisted living does not have an enhanced license. I would say most of them, and I'm speaking for New York.
Most of them don't?
No, most of them do.
Most of them do.
Yes. So it's shifted a little bit. So people can age, and it's not only age, it's when they lose functions or need more help from a nursing perspective, they can have that in assisted living. And then, as I said, nursing homes, and some people can't afford assisted livings and need a nursing home for that reason, but would need care on some level. And then there's also, there's also continuing care retirement communities.
I was just going to ask about that.
Yep. So that kind of combines everything. And it's a big buy-in. It could be anywhere from $4,000 to $1 million and maybe more. You do get part of that back, and it's all different. So I can't say an exact number. Average maybe 40%, give or take. But you're guaranteed that to have care. You're guaranteed that if you go into a nursing home, you go into into a hospital, sorry. If you go into a hospital and come back for rehab, you can go into the nursing home rehab. So they have some from independent assisted living nursing home. You age in place right there in that community. And they have, and like I said, if you need from the independent, the assisted, they will have space for you.
Right. No, that's more and more people are doing that, and there are people, quote unquote, younger people doing that. People in their 60s who are starting in the independent living, and then with an eye on that. And there are a lot of different communities. It's
yes.
Yeah.
Not
a whole lot. Are there many in New York?
There's a few. I'm based on Long Island. The South, definitely Florida, the Carolinas, they have more.
I know New Hampshire has a number.
Okay, yeah. And we have a few. We have some for sure, more than we've had. Again, they propped up the last 5-10 years.
Right. And so, how do people pay for assisted living or independent living? How does that work?
Well, independent is private pay. Because you don't need care. It really, the Medicaid and long-term care insurance. So there's 3 ways to pay: private pay, long-term care insurance, Medicaid. Not everybody has long-term care insurance, and not everybody qualifies for Medicaid. Independent living is only private pay because you have no care needs. Right. You're independent, you're cooking, you're going on your own. It's an apartment, but there may be an assisted living attached, so you're right there. Assisted living, some of them do take Medicaid. They're called ALP, Assisted Living Program. That's the kind of Medicaid you get for that. And nursing homes, most of them take Medicaid.
Right. But the ALPs, you have to. I mean, you have to be able to take care of yourself, correct? Like you can't have a 2-person transfer or anything like that?
Good question. I think it depends. 2-person would be tough because that takes more, that may be a nursing home situation, right. But they they, again, the activities of daily living, bathing, dressing, um, toileting, feeding. They'll be able to feed people if they require that. So it's pretty much, again, with the enhanced license, they really can do a lot, and you may not need a nursing home. Some facilities you can go in. So say you have community Medicaid, you can go in straight Medicaid. Others have a waiting list, and you might have to wait a few months and pay privately.
Right.
So again, it depends on the person's assets or the family's willingness to pay.
Yeah, no, it has a lot to do with everything, doesn't it?
Absolutely.
So what factors come into play when choosing an assisted living facility?
Well, to use a real estate adage, it's location, location, location is certainly really important. If you have family and support system around, again, speaking for the Northeast, in the winter in a snowstorm, you're not going to travel that hour. Or if it's 10 below, it's just good. And even just the time getting to a place. So really depending on where the family is, and there's so many, again, speaking for Long Island and Queens and the, more populous areas, they're practically on every corner now. So, you really do have a choice of various places wherever you are. So why go, a half hour, 45 minutes away? So that's, certainly a factor. Cost, of course. There is an array. There's, you say high end, I would say the more expensive, not necessarily better.
Interesting.
But there's newer places. Again, some of them are 25, 30 years old. They do update them. They definitely try to improve the facility physically. As I go around to them, I'm seeing that the older ones definitely, try to do that because it's big competition now. It really is. I think COVID really changed the industry. COVID and also the additional facilities that have been built in the last 5-10 years.
How did COVID change the industry?
Well, unfortunately, as we know, New York State did not do well in terms of this population and COVID, and many people did die, and they were isolated. They died from COVID, and the isolation affected them
A lot. Yeah.
and maybe precipitated a downhill, situation. And I think so that loss, and then people got scared to put their loved ones in these facilities. So I think that definitely had an impact on it because it used to be some of them you couldn't get into. There were lists. I don't see that now.
No, yeah, so that's very interesting. And then the other part of that is, as you said, because of the competition, there's more volume.
Right.
Yeah.
Right.
But as the population ages, there's opportunities from them to fill those rooms.
Absolutely. But people, again, the competition is always home as well. And we have choices, and that's great, right? So go ahead.
You mentioned about helping people stay at home. Could you talk about that a bit?
Sure. So again, my background as a care manager, and I still feel this way, that home is best if it's safe, if there's socialization, if the care is there. And it's harder. It's definitely takes more resources and possibly more money to stay home. And again, if you have long-term care insurance, that could follow you wherever you go, for those who are lucky enough to have that. So, just you're in your own environment, you're in your own community. Change as we age, and those with cognitive issues definitely has an effect. So the less we can change, again, this aging in place, whether it's at home. So if I go to see someone and, do a full assessment, I can show them how they can live at home. If it's assisted living is always an option, or independent, whatever their, level of care needs are. And I think people do stay home longer, and maybe too long. Again, it's all individual. We're all unique, and it's I've testified in many guardianship cases, and depending on the situation, I would say, let's try it at home with these interventions. Or, you know what, based on a family dynamic or financial issues, these other places are better, in a Medicaid situation, say.
Right. Um, yeah, no, I see it myself with my clients that everybody wants to stay at home at all costs, if possible. So it is, and everybody's different again, So there's some people who can't, who really seek the socialization,
Right.
and that's one of the great things about these facilities.
Absolutely.
So when somebody's touring a facility, what kind of questions should they ask?
Well, keeping in the financial area, I would ask for the history of increases in the
Mhm.
last 3-4 years. I think right after COVID, they got burned financially, I believe. So I think there was some makeup of that a few years ago. I think that has calmed down a little bit. So I think that's an important question that usually doesn't come up in a tour. Uh,
Yeah.
um, Staff turnover or lack thereof, you want to know. And I think for the most part, a lot of them, from my experience, are pretty good with that. But it's certainly good to know that. Um, there is rent, and then there are care levels. Now, there are a few facilities that include everything. So you want to know what's included, what the care levels are, because even if whatever care level you're at or none, the idea again is to age in place. So you want to know.
What do you mean by care level?
So they charge most of the assisted livings, not all, some of them are inclusive. They charge for, as I said before, for, if you need help getting up, help getting dressed, showering, dressing, and they have certain care levels, and it's based on their what they look at, how much time this will be,
Sure.
right? So
Because you don't have an aide in your room with you.
correct, right? It's like cluster care.
Right.
There are aides all over, and hey, somebody may need nothing, even in assisted living, and someone may need 3 hours a day. You could be in a wheelchair, and they will transport you. So based on time, so they could have, some of them have 3 care levels. So care level A is 200 a month, care level B is 400, care level C is 550, right? And then some of them have like 6 or 7, based on X amount. If you need medication management, a lot of them include that. They'll give you like 15 minutes a day, and then start up with, again, dressing, bathing, transporting. So based on the care levels, then it could go up to, quite a bit of money and quite a bit of care, and that's what they
Yeah.
do. So you definitely want to know that, and not only for the care you need now, but what you may need in the future, what this will cost in 2, 3, 4 years. You really have to have it. I would also say, again, on the cost basis, financially, you really want to stay and have enough resources and income to stay in a place for at least 3 years. I would say, it just to stay somewhere for a year and then, you can't afford it anymore, just not worth it.
No, it's not.
So that's what I would do.
Yeah. Um, and and how do you work with the facilities? How does that happen?
Well, it is no cost to clients, and the facilities do pay me for anyone I place and who stay there, for about a month.
Right. And I mean, I know from my experience that the value there is huge because you're able to show them multiple places.
Right.
And
Well, I think the value is, again, with me, as with my experience and my expertise, to be able to really assess people and hone in on, yeah, here are 3 places that I think you would
right.
like. And it's so much, we can go through checklists and discuss what we're discussing, and then it's the tour and it's the feel,
Right.
And I would also suggest, they usually ask for people to come back for lunch, and I would suggest that. And that's to really see what's going on, to taste the food. They're going to give you the best, and they, for the most part, the food is pretty good. they've definitely improved that. That's not from experience. I don't eat there, but from people I talk
Well,
with.
we've tasted the food when we do our networking events at
That's true. That's
you know,
true. I'm not sure if that's the same food, Peter, though.
you never know.
That's true.
You never know.
No, they do. They really they've upped their game in general.
Yeah,
For sure. It's
yeah.
a big part. I mean, people don't like the food. That's going to be a problem.
Absolutely. And I've never had a complaint from a client in a facility saying, no, I hate the food.
Right.
But you never know.
Yeah, true.
Well, that's great. So, Anne, what's the best way of people to contact you?
Sure. They can reach me at 917-391-0989. My email is amr@agingexpert.net.
Right. And all that information will be in both the video screen and the podcast
Great.
screen as well. And that's what we have. So thank you so much, Anne. It was a pleasure seeing you again.
Same
And
here, Peter.
to everybody out there, we'll see you at the next video.